and we're going to jump right in with Jason from Clinton Health Access Initiative, CHI. Jason. Need to get you off mute, brother.
Sorry about that. Thanks, Tom. Thanks, Lee, all the other panelists. I think we can go ahead and just jump right in to the next slide. I wanted to shift gears a little bit. So as Paul was describing kind of broadly the oxygen need and the clinical basis for oxygen therapy, and prior panelists had talked about the increases that we see in oxygen need, I wanted to frame the scale of the problem a little bit. So we know that when we're having a COVID spike in a country, we're going to see a huge influx of patients coming into the facilities. But those patients also require a massively greater amount of oxygen in their treatments. So 2 to 6 times more than an average adult ICU patient. And this is really going to put a stress on even the better equipped hospitals out there, right? So it's not just a matter of, do you have hospitals that have a supply of oxygen and are you going to outstrip that? But other parts of the equipment and the systems that deliver oxygen are going to be strained by that increase. This is why we saw in hospitals in Los Angeles, the vacuum insulated evaporators that are actually vaporizing the liquid oxygen into the hospitals freezing up, because the volume of oxygen that was being required, that was being pulled through that system, wasn't, the heat exchangers couldn't keep up with that, right? So in Europe, we saw 5 to 10-fold increase in the medical oxygen demand in their COVID spikes. In the United States, North America, we saw greater than 6-fold increase. And India in April, May saw an 8-fold increase in their demand for medical oxygen. So these are huge numbers. And this is why we're all seeing the headlines in one country after the next of hospitals running out of oxygen or their equipment failing in their ability to deliver it. Because it's not just a small increase, it's not just a greater patient load, it's a really massive increase on the demand, especially where you have already weak systems. You know, that's really going to stress them, and it's going to lead to very high failure rates. If we can go to the next slide, please. And this is important because, kind of calling back to one of the visualizations that Alex used earlier to kind of show how quickly this type of a situation can materialize. You know, it's a matter of weeks when you get that increase in caseload and you see that coming through in terms of the increase in the demand that you have for oxygen. So the challenge is not just the scale of the increase, but it's also the speed of that increase, right? And biomedical engineers, given their role in the hospital and their knowledge of the systems at play, can play a really critical role in that flat period, in that trough where you have more time and perhaps a lesser sense of urgency to help hospitals assess what their equipment configurations look like and where those pain points or constraints are going to be when you actually do have those increases. So there's a level of planning on the ground that biomedical engineers and their associated cohorts can facilitate to improve preparedness on the ground. And as Paul said, really working hand in hand with the clinicians to understand how you make that link between the supply to the hospital and the supply to the patient as robust as possible. But there's also a macro level planning and preparation that has to happen. So I've put here some kind of illustrative timelines for the different types of equipment that can be brought in to augment oxygen systems capacity. But uniformly, your best case scenario in most instances is you're waiting a month or more to get some of this stuff. And oftentimes they're things that have to be put together, right? And we know that during these peaks in COVID, most recently with India's spike, the global supply chains for a lot of this equipment can get tied up very fast. And that increases lead times, not just where you have these big spikes in demand, but also for other countries that are maybe trying to prepare early. So it's really critical to plan ahead, because if you start reacting when the cases are increasing, most of what you're going to be able to do is probably going to come after that spike in cases. And of course, Nepal is seeing this right now, where they're trying to move quickly, But as the Oxygen Industry Association has pointed out, most of what their suppliers are able to do are things that take a couple of months, and there are steps they can take in advance to make that quicker, but it has to come through in a planning process before it's necessary. Next slide, please. So the good news is that most countries do have existing suppliers that they can work with in that macro level planning. And I think Jim is going to talk a little bit about what's possible in terms of getting existing equipment up to speed or increasing its capacity. So what I wanted to focus on was what's really necessary in terms of engaging with some of the existing suppliers in order to increase or be in a position to increase output quickly. So I use Africa as an example here as a continent that probably has some of the least developed gas markets, but you still see a pretty good presence of both major industrial gas suppliers, but also of smaller merchant suppliers or PSA plant operators, right? So in India, as an example, Linde did actually respond to that COVID surge. They increased their overall output for medical oxygen by 1/4, brought in 60 additional large cryogenic storage tanks, and doubled their cylinder stocks. All of that obviously came late, if you're talking about from the perspective of when that surge was occurring. And ideally, that could have been pre-planned and brought in ahead of time or accelerated. But it's a good example of what's actually possible when you work with those existing suppliers to get things in place for when you do have those surges. Next slide, please. So how do you facilitate that? So far, as Alex had pointed out, we've seen a lot of reactivity. So we see a lot of headlines about countries, suddenly banning the use of oxygen in industry and diverting that over. And I think Ali talked about this a little bit in her presentation in terms of the guidelines and the regulations that need to be in place. And there was a question, I think, from a participant in Mexico earlier about whether you can use industrial oxygen for medical purposes. And the answer is generally yes, but you do need some additional regulatory guidance and processes in place to facilitate that switch and make it clear how you're going to do that and what measures need to be in place in order to use the industrial oxygen for that. So those plans on the books, both in terms of what are the guidelines and the regulations for diverting both the oxygen and equipment from an industrial use to a medical use in order to respond to a surge, but also in terms of working with the suppliers themselves to help them figure out what their response plan will be, what they might need to pre-position, and also secure the financing streams ahead of time. So understanding how you will ensure that you can pay for the oxygen that's going to be necessary. In a lot of countries, this is going to be challenging, but we have seen a lot of donors bring in their interest, not just for these very short-term response efforts, but really asking countries, do you have a surge plan? And if you do, what do you need in order to be able to execute that? And that's opportunities like what the Global Fund is putting out there. I think what Robert was talking about in terms of UNITAID's interest going forward. And a good example of that in South Africa is that USAID actually did help the South African government pre-purchase a lot of additional medical oxygen from Afrox in order to have that on hand for their hospitals. So how does this relate to biomedical engineers and where can they come in? Well, the biomedical engineers in the room usually have a lot of very detailed knowledge about what the private sector supply chain looks like for medical gases in the country. And because oxygen hasn't really been a big focus in the global health industry before, you don't really have a ton of folks within your Ministry of Health who might be in these planning committees for COVID response and are highly knowledgeable about that. So in my mind, biomedical engineers, there's a role to play in terms of bridging that gap between the industry suppliers, both the small scale and the large scale, and the public sector need to help facilitate that planning process so that it doesn't become something that people turn to once they're already seeing that dramatic increase in need and the options are a lot more limited. but I'll end there and I think hand it back to Tom.
Thanks so much, Jason. And